about the class?
Well, I think that it's true that we talk about social skills. Part of the issue is that, they get the diagnosis and then they withdraw from social contact. And I understand that. It's hard.
The parents are going through a crisis stage. They're just diagnosed. They go through the grieving process, and all of a sudden, my kid's not going to play baseball with me anymore.
Right.
What do you think about us getting together and with the people we know and do a understanding autism class?
Well, I think that might be a very good idea. A lot of parents have essentially similar questions. They want to know, in essence, what's going to happen. I mean, it's not like it's a mystery what they're worried about. They're worried about the future.
Yeah.
And so we need to say, look, here are some things you might do to see what works. It's kind of an empirical or, trial and error thing where let's see what works for you.
I was asked just recently on my Facebook page how you go about changing the maladaptive behavior of a child with autism. They'd sent in a note, and the note said, my 8-year-old child continues to tantrum and yell and scream, and I wrote back, what was the antecedent? What was going on?
Yeah.
And she says, well, he didn't want to take a shower or take a bath.
And it's important to say what was going on when it happened, because often parents will say this happened out of the blue. It didn't happen out of the blue.
It never does. We work in this industry as an antecedent, a behavior, and a consequence. An antecedent is what happens beforehand. Well, and we have things called setting events. A setting event is that particular circumstances that cause the behavior.
Yes.
And so all these things that we as parents normally do with kids that aren't on the spectrum, we all of a sudden got different deals. And if I can just say one thing, if you have kids that aren't on the spectrum and you have kids that are on the spectrum, why are you treating them differently?
Well, I think that there's a sense of fragile, where parents especially want to say, look, my kid is fragile. I want to be really careful. Other kids, I'll walk around. I don't care. We'll go do this or that, But this kid is fragile. He cannot manage. Well, okay, but the problem is that those knocking around events, baseball teams and, I go down to the mall or whatever, those are learning experiences too.
One of the things that you and I were talking about last night was the categorization of kids with autism. They have certain specific groups of things.
Yeah.
One of the things that always made me laugh is that the lack of social skills. Well, gosh, if you've got a kid who's 7 years old and you've never let him out of the house and he's never been down to the playground and he's never participated in sports, social skills are learned behavior. And if you're going down to the playground and you're a bully, let me tell you, there's a bigger bully.
Yeah, and they're going to teach you
how to act.
Yeah.
But if you never allow your child who's autistic to interact in that environment.
And get out of your sight and manage.
Oh. I just love working with the kids. I get fired a lot from parents. And because they worry about me commenting on their parenting skills. Well,
right. Well, that's not really the issue.
It isn't.
It may be true that there are some things you can do that will help and make it better, but it really is kind of an overall mindset rather than individual techniques. That will change what's going on. We're talking about the dyadic or the two people interactions, or maybe three if you have two parents. What is the interaction? That will tell you what's going to happen. Not necessarily, yeah, the kid's rocking and how do I stop rocking? Okay, let's talk about the bigger picture here.
Yeah. Self-stemming behaviors is what you're talking about,
Yeah.
and those are learned behaviors also because they've been reinforced and it feels good. And, well, if that's the only thing that's causing a problem, we can fade those type of behaviors. But the biggest portion of the things, again, as an IBI therapist, I'm called in at the end of the rope. Kid's 15. He's been, he's been going insane. He's causing grief, and then all of a sudden, the parents are saying, "Gosh, I've had enough.
Yeah, I can't deal with this
I can't deal with it anymore." So the kid is diagnosed with autism. The parents have done a great job, and all of a sudden, 15, the things that he learned at 4 years of age, the tantruming, and the behaviors that have been learned and reinforced are efficient for him to get his wants and needs met.
Yeah,
So
and now he's 160 pounds and a man. What do I do?
What do I do? Gosh, where were you when he was 4 saying, "Hey, you can't do that"?
Yeah.
Well, if we learn naturally in an environment, if our children who are not affected by autism are in an environment and they scream and tantrum and they're 4 years old, you grab them by his arm, you put them in a place, and you say, "Hey, knock that off."
Yeah.
Well, the kid then learns in a natural environment acceptable behaviors. And it becomes a natural learning experience, so that you go to the playground and you push somebody's going to push you back. Probably not a good idea to push this guy.
Yeah.
So you learn on the playground, you learn with your sports teams about acceptable behaviors. Well, if the only person that a child is interacting with is the one who loves them the most and allows the behaviors to be learned and reinforced, that becomes an efficient method of getting his wants and needs met. So at 4 years old, it might be okay, but at 16, when he's 160 pounds and he's tantruming and he's yelling at you in
Not
Kmart,
so much.
not so much. So they call an IBI guy in there and say, "You're going to have to spend the next a couple years, 3 years in the past, but it's become so expensive that you're going to have to work with this kid 40 hours a week to change his maladaptive behaviors." Well, no, they're just going to put him in jail because at 18 he's going to hit somebody and there's a problem. So
They go to jail.
he goes to jail because autism is not a defense for violence and stuff. So we're doing our first one, and we've come a long way in a short period of time, and Mac, I am just thrilled to have you with us.
Well, thank you. Well, I guess what comes to my mind is that it's not too late now to start. It may be true that it would have been better at 4, but the kid's not 4; he's 15. Okay, now what? Well, better now than never.
That's right.
And I think that sometimes we lose sight of the fact that, what, I can start now. One of the things that, as a psychologist, when I meet with parents, very often they say, "Well, I have this problem or that problem." And my thoughts were, you could have corrected that early on, and you didn't. Okay, it's gone. Early on is not here. Now, start.
One of the things that the foundation is doing is sponsoring sports academies. Again, there's a lot of, we know the benefits of team sports as a society, interaction and societal norms and those type of things, but it's a process now of inclusion because parents are afraid. They're fragile, as you talked about. Don't know what to expect. Don't know. Well, let me suggest to you that even at 15, a child learns behaviors. He sees something that's fun, wants to participate in that. If there's no place for him to do that in, he's never going to learn.
Yeah.
But if you're given the opportunity to see the benefits, we're doing a neat thing with the martial arts nationally.
Yeah. That's exactly what I was thinking of. my kids are very involved in martial arts, and one of the things that you very quickly learn is that there are parameters of behavior that are okay. And you don't punch too hard, you bow onto the mat. There are things you do, and I don't care who you are or what your condition is, you do this. And that is something that you don't often get from parents who think this kid is wonderful, I love him, I want to help him. We talked a little last night of this parent that I treated, or at least I sat in on the treatment, on a sleep disorder. And the kid had cystic fibrosis, so a lung disease. He was going to die at early teens, 12, 13. And he was 04, and mom said, how can I deprive this kid of anything, given that his life is going to be so short? And so that was something we had to battle. And I understand that is painful. However, the child was really unhappy with the no boundary, no parameter, no nothing. Where mom would accept anything. Mom knew that was not a good idea. She was trained and she knew it was a bad idea. However, she couldn't stop.
She loved him.
She loved him.
Yeah.
And I'm not at all saying let's be harsh. I'm saying let's set up rules and hold to them. And I think that parents ought to be cheerful about it, not going off the handle or freaking out, You're not going to yell at the kid to stop yelling. That's not going to help. Parents ought to be calm. That's our job.
Parents should be parents.
Yeah.
Parents aren't supposed to be friends. And so if and let me probably say a little bit more of that.
Yeah.
I have an obligation as a parent to make sure my child progresses so that he becomes a member of our society and it accepts acceptable behaviors. I love my children, and sometimes I don't like my children for the behaviors, but I love them.
Yeah.
But their behaviors have been learned and reinforced by me, and it becomes my problem to understand that they need direction. And you were saying something more about this kid that when he first came into your practice.
Yeah.
It was just an amazing deal.
Well, what happened, I was working with a rather famous neurologist on that sleep issue. They were not coming for autism. And the kid wound up and just kicked mom in the shin hard, and mom did nothing. The neurologist said, no, not in my office, and grabbed him and put him in a hold, a very safe hold. And the kid responded great.
So he had a behavior, and there was a consequence. Consequence was that the doctor said no more.
Yeah, the doc said, look, this is my office. You don't ever do that again.
And mom did nothing. She just sat there. She teared
Mom
her
did
eye.
nothing. She cried. I would have too.
Yeah.
If he would have kicked me in the shin. But part of that was that mom felt like I can do nothing that would impinge on his
8 years more life.
Yeah.
So she was going to complicate it by not putting any parameters for him, so causing him more confusion in his own life. Yeah.
And in fact, when we got her to put parameters on the child, she came in, 2 weeks later, and literally was tearful and crying, and said, I never knew what a sweet guy this was. He is a wonderful kid. I'm really going to be sad that he will die soon.
It goes
And
from
she didn't know.
Because he was such a out of control.
Yeah, And she goes, you know what? I thought he was my cross to bear until he died. And now I realize he is a sweet kid, and I love him. And that, in some ways, makes his death harder for me.
Well, yeah, it's death is a process, as all things, and we all suffer the eventuality of not only our parents, but our children and ourselves. But not liking your child because you're afraid and not being able to parent becomes a burden not only to the child, but also the parent.
See, I don't think she was conscious of not liking him then. I think that she was resigned.
Resigned, that's a good word. Yeah.
Once she got some parameters and he felt good and all that,
Felt
she
safe.
loved him.
Felt safe.
Yes.
One of the things that that the kids that I work with deal with daily is stress. So they come into a classroom, and instead of allowing a transition from a stressful environment to another environment and allowing them to adapt to what's going on there, the first thing that happens is they're engaged. And because they're engaged, they've been conditioned to respond. And they're under stress, and so the teacher says, hey, Johnny, how you doing? And Johnny just came from a tough class, and so instead of saying, and again, if he's nonverbal or if he's Asperger's or if he's just a kid on the spectrum and he's got a lot of echolalia in his component, the first thing he talks about is the song of Pocahontas.
Yeah.
Because that's what his long-term memory has captured in a stress-free environment. Yes. So a stress-free the stress of him not being allowed to adapt into that environment. So teacher comes up and says, well, gosh, he's communicating. No, he's not communicating at all. All he's trying to he's responding. Yeah. Because of the thing. So when we first started and we got onto these great things, what do you think about us as a group doing a understanding autism from our perspective type of deal?
I think that parents really will benefit from that. And parents need an outside look at what's going on. They end up being so involved. Last night we were talking about, why would a professional parent who knows better not do something right for their kid, not do this? And my response was, it's a lot different when it's your child than it is when you're an outside consultant. Yeah. And the person I was talking to said, that is a very interesting answer. And I think that's important to realize, that when you're faced with a day-to-day kind of grind, it is different than a 10-minute, I'll walk in the class and look at the child.
No parent that I've ever met and worked with wanted to be told how to parent, and it is not our responsibility to tell. I couldn't, having raised 4 kids, and the first one the hardest because you didn't know what you were doing, and the last one you just said everything will be all right because you learn. But it's not that's not the purpose. We have experience that might help. Yeah. But be it far from us to ever think that we have any more insight into your abilities to parent than we could.
And part of that is that as a parent, you get information that others can never get. What I mean is you have experiential knowledge that an outside person cannot get. And it's not that they can't understand, it's that they're not there. They cannot understand like mom and dad do. They can't.
It's just life. Hey, it's our first one. We did a good job.
Yeah.
And the next 60 should be a lot easier. Hey, I want to thank you for being here today.
Thank you.